Okay, hello, good evening. I welcome all to the session of OET Speaking. Now, today's session will focus more on speaking criteria and what kind of sentences you can use when you are doing your speaking cards. So many times I've seen that people continuously use the same statement and again, I understand your concern, I understand your concerns, or some other statements. Repetitive statements are something which has to be avoided when you do your OET speaking. So that's the reason this lesson will cover up all the topics, all the type of statements in your OET speaking. If you have any questions, any concerns, you can put it in the comment box and I'll be able to address that. Now, first of all, let's understand when you do your speaking, what is the assessment criteria based on which your assessments are done? So there are two major criteria. One is linguistic, another one is clinical. Now, in terms of linguistic, if you see, the first criteria is intelligibility. Now, intelligibility doesn't mean that they'll check how intelligent you are. No, they'll check that how smartly you handle a situation. What kind of statements do you use to calm down the patient if the patient is very much agitated, patient is very much angry? How do you handle that situation? That's called as intelligibility. Second is fluency, how fluent you are in your language, how controlled you speak, how well your pace is maintained, how well you ensure that your patient understand what you're speaking about. Third one is your grammar and your expressions, how well you express things and what kind of grammatical ranges do you use. This is something will be covered in your linguistic. And the last one will be appropriate language. Now, what do I mean by appropriate language is if you are speaking to a patient, you will have to ensure that whenever you speak in simple language. Like, for example, if you use the word hypertension, many a times patient may not understand what is hypertension. Patient may understand what is blood pressure. The same way, like for example, patient is on a medicine of like anticoagulation. If you use the word anticoagulation, most of your patients will not understand, they'll not follow. But if you use the word blood thinner, many of your patients can follow. That's called as appropriate language. When you are speaking to your patient, ensure that you speak in appropriate language so that they understand. Next is the clinical criteria, which includes rapport building. Now, how do you build rapport? When you speak to a patient, it is very much important to call out the person's name. And initially, when you begin, it is important to ensure that you greet your patient well. So, you will have to make sure that you make your patient comfortable, provide them appropriate empathy, which is required, so that they can connect well with you. So, that's how we do our rapport building. Next is understanding patient's perspective. Now, how do you understand patient's perspective? By asking more questions, by gathering more information about the condition. Only then you can understand patient's perspective and be a good listener. Don't be in a hurry to complete your card. You have to be a good listener, understand what your other person is telling you, listen and then comprehend. Listen, comprehend, and then speak. This is important when you want to understand patient's perspective. Providing a proper structure. Now, structure, when you're trying to give out an information, your patient should be well aware that what kind of conversation they are going into, whether you will be listing out the needs of the patient, whether you will be giving them list of advices that they need to follow, and what would be the conclusion. So proper structure of the communication is something that you need to follow. And it is very important when you are speaking in your OET thing, it is very important for you to understand you will have to gather the information. Once you gather information, then you should give out the information. So clinical is something is all about gathering the information and then giving out the information. I hope this part is clear, linguistic and clinical. If any part is unclear, ensure that you type in your comment box. I'll make sure that the explanation for that particular criteria would be given to you. Okay, now let's take an example. Now, this is the card. It is very important initially in the 3 minutes, when 3 minutes are given to you, it is very much important for you to understand the card well. So you will have to ensure the card is given to you and make sure that you read the card well. So you'll have to ensure the card is read well. And the first 3 to 4 lines, which is about explanation of the scenario, you need to understand that very well. Because over here it says you're speaking to the son or daughter of an 82-year-old female patient who had bunion surgery. The patient will be in son or daughter's care for the next 6 month recovery period. Now, understand this. Many times it happens when you read a card, it is not necessary every time you understand the diagnosis. It's okay. If you don't understand the diagnosis, read the task carefully. You'll understand which part of the body are they talking about. Because if you read this card, many times you may not know what is bunion or banyan. When you read this card, you'll understand this is related to foot. So you understand this is actually the extra growth of your thumb bone present in the thumb. There's an extra growth that's called as bunion. So bunion surgery is all about removal of that particular extra growth. So it's related to foot. But if you don't understand, read it carefully, you will understand which part of the body they're talking about. Next thing, when you prepare a card, it is very important to pay attention to the first word of the task, because the first word will direct you what you have to do with that card. Very important. Now, after this slide, I would recommend, if you're watching this lecture online, maybe live or maybe later, if you're watching it, keep a book and pen with you, because there are certain statements. See, even if you prepare 5 to 6 statements, be very clear with it. 5 to 6 statements, if you prepare, it'll be very easy for you to dive through your card and sail through it very easily. First is pay attention to the first word of every task, because the first word will direct you what you have to do, the action. First task over here, it says find out, which means you'll have to gather some information. Second is about explaining certain things. Third is about reassuring. Fourth and fifth is about explanation. Explanation comes when there is usually a question raised from the examiner. So always remember this. If you're doing a card and if you see the word explain, which means this particular task requires you to explain something. It may be a concern from a patient, it may be a question from a patient. So you will have to ensure that you give appropriate explanation. Okay, now let's understand. Now the main aim of this lecture is all about giving you appropriate statements, because many a times when you do speaking, it happens that you keep on repeating the same statement. So how to avoid that, that is something we'll be doing it over here. Now, as you can see, the first one is all about find out. So whenever your task is about finding out something, which means you're gathering the information, you're finding out something. So how will you do that? So first is, like, if your first task, remember this, if your first task tells you about finding something, don't merge it with your introduction. Many times I've seen that people doing this. Hi, my name is George. I'm the GP of this department. What brings you here today? Don't do it. First, start with your introduction. Hi, good morning. My name is George. I'm the GP of this department. How are you doing today? So let him say that, okay, I'm doing good. Then you can ask him, could you tell me what brought you here today? So remember this, if you are doing a task which is about finding out something, now depends on the situation, it would change. Now, here the situation says find out how prepared the son or daughter feels about the mother's discharge. So it is not necessary you ask him, like, could you tell me what brought you here? Because the task clearly tells you that you have to find out whether the son or daughter is prepared. So your response can be a little different. Could you describe how do you feel about taking your mother home? So remember this. When you want to find out something in general, you can use statements like, could you tell me what brought you here today? So he will tell that, okay, I'm here because I have these symptoms, I have these conditions. Many times the card is about disease conditions. So this will give you a clear idea why the patient has come to you today. Or if the situation is all about her experience, like for example, you want to find out what experience patient has with this, you can ask him, could you describe what are you experiencing? Or I would like many a times it happens that there will be a series of questions. Like for example, you're talking to a mother of a 3-year-old daughter, and there are a series of questions. What's her sleep pattern? What's her bedtime? Is she toilet trained? There are a series of 4 to 5 questions. So before you begin, you can ensure the patient is comfortable with that. So when you want to find out a series of answers for a series of questions, you can ask statements like, I would like to ask you a few questions to better understand her condition or your condition. Depends on what kind of card do you have. If you have direct patient, you can say, I would like to ask a few questions to better understand your condition. If you're talking to a relative or a carer, you can say, understand her or his condition. So ensure that you ask such question. And from the beginning of the card, be very clear and thorough in your mind that you have to be empathetic. Don't feel sorry for the client. Sometimes it happens that many a time students, they act too much, which is not required. Oh, I'm so sorry to feel that. No, no, don't do that. Don't do that. You're talking to a patient, you're a professional. You're not doing a kitty party or a chit chat with a patient. No, avoid that. Be professional. Okay, you can say that I understand what you're going through, rather being sorry. I understand it would have been difficult for you. So you're trying to feel what she's going through. You're trying to show her, I understand what you're going through. That will gather more points than being so sorry or than being too friendly with the patient. No, don't do that. For remember that this is a professional exam. You have to be formal. So you can keep these three statements when you want to find out something. Now, the second task is all about explaining the mother's needs. When you're explaining information, you can use few statements before you start. That will ensure the patient or the relative that she's going to gain something, she's going to get some informations from you, and you are trying to show the patient that I am with you, I am going to make this simple for you. Because many a times whenever this explain comes, that will usually be explaining the difficult part of the treatment, maybe explaining the condition of the patient, maybe explaining what she is going through or why she is going through. So you'll have to ensure that you have an accompany with you, that's me. So you can start with, whenever you want to explain something, you can say that let me go through this with you, which means I'm there with you. Let me explain what is happening. Let me explain. Let me help you go through this. These kind of statements will ensure patient and they will be at pace. They will that this these statements will pacify the patient. This is very much important. You'll have to pacify the patient. You will have to ensure that patient is comfortable with you. She's coming with a lot of anxiety, lot of worries. When you give such statements, let me go through this with you, let me explain what's happening, let me make it simple for you. So you're giving a reassurance, okay, this boy or this girl is going to make it simple for me. So that's something we call it as empathetic. Just using the statement, I understand, let me explain, okay, I know what you're going through, will not help. You'll have to show that. So these statements can help you to show that. Let me explain what's happening. Okay, or else if there are series of questions to be asked and then explain, then you can use the same statement again. I would like to ask you a few questions to better understand your question. Remember this, the first two statements, let me go through this with you, let me explain, let me, one more you can add it, you can write it, which is not there on the screen, you can write it, let me make it simple for you, when you want to explain something. Because explanation will only happen when there is a question coming from the examiner. So obviously, examiner will ask a question which is of a concern. Like for example, over here, first you found out how the son or a daughter feels about a mother's discharge. So obviously, she would give a positive or a negative response, and mostly it's a negative response. She may not be prepared. Then you have to explain for the first 8 weeks. So she would say that, okay, I don't feel so, I'm so ready to take my mother home, to take care of her, because I'm not that competent. In such situations, if you tell the patient, okay, let me help you with this, that's a relief for a patient to listen. That will highly help her to understand what you're going through. And I'm guaranteeing you, if you're using such statements, definitely you will easily score 400 and above in your speaking. Okay, so explaining information, you can use such statements which will give you a better understanding. Now, third one, over here in the task, it says reassure. Many a times in the cards, you will get this task of reassuring. Reassuring means what? First of all, you gave all the explanation. Patient is a little bit worried. Now you're reassuring, not to worry. Everything is in control. You are in the safe hands. You're reassuring the patient. So using reassuring, you can use statements like, it's completely normal to feel this way, which means you have an expertise and you have seen such kind of conditions and you know this response is normal. So you are reassuring the patient. It's completely normal to feel this way. Many times what happens is patient says that, I'm not sure, I'm worried, I'm anxious. I don't know whether these things will fall as I'm expecting. I don't think so. Will I ever get better? When you say it's completely normal to feel this way, you're reassuring the patient not to worry, I'm in control. I'm there to help you. Second statement, I can understand how stressful this is for you. Now, why I'm giving you three statements. You will never have one task action repeated more than 3 times. Like, for example, the task action is reassure. Maximum, you'll have 2 tasks of reassurance. If it is explanation, maximum you can have 3 tasks of explanation. If it is finding out, maximum you can have 2 tasks of finding out. So I'm giving you 3 statements to be ready with. First can be, it's completely normal to feel this way. Second can be, I can understand how stressful this is for you. Third one, being very empathetic, we will handle this step by step when you're reassuring and giving out information. If you see in this card, it is all about reassuring and giving him some more advice. How to be in control of mother's needs. So you can say, we'll handle this step by step. Let me explain this to you now. You're trying to be in control of your conversation and you're putting your patient at ease. This is very much important when you're reassuring the patients. Okay? So I believe you guys are noting it down in your notebook. So if any questions that comes in your mind, any feedback for the lessons, you can put it in the chat box. So from the next lesson, I'll try to implement that to give you a better service in terms of learning. Okay? Perfect. Now, many times it happens, you will get a card where the patient is very adamant, doesn't want to listen to you, patient rejects your opinion. So you can use any of these statements. One of the common ones which everyone uses, I understand your concern, or I understand what you're going through. Or if you want to make a difference, you can also use, I can see we have a difference in opinion. Like, for example, you suggest the patient, I want to take the vital signs first, but patient is adamant, I want to see the doctor now. Okay, but you're saying, I want to check the vitals. Patient saying, I want to see the doctor now. So you can say that I can see we have a difference in opinion, but I can assure you, I have your best interest at heart. Or I understand your concern. But you will have to be very sure that you're flexible enough to use your language to use these statements. Don't make a mistake in using this statement. Or I want to ensure you get the best possible treatment. So I need to take your vital signs. And later, see, when you're doing your speaking, never say no to patient. Patient says, I want to see the doctor. Don't say, no, you cannot meet your doctor. No, that's being very rude. When your patient is asking you to do something, take a passive attempt. What you can say is, definitely, yes, I'll help you with this. You want to see a doctor? Definitely, I'll help you. But first, let me finish your assessment. Then I'll ensure a doctor comes and sees you, and no examiner is going to pull you too much. But you need to be in control. Don't get panicked. Don't fumble. Avoid that. Be in control. Say yes. I need your phone number. Yes, I'll definitely help you with that, but after a consultation. So you can use any of these statements when the patient rejects your opinion. Asking consent. Many a times it happens. There are a lot of questions. You don't want your patient to be irritated. So you can ask a consent. Do you mind if I ask you a few more questions? Would that be okay? Use more of could and would. That's more polite. Do you mind if I ask you more questions? You directly say, can I ask you more questions? That's being very rude. You have to be polite. Would that be okay if I ask you more questions? So this will ensure that you're being very professional and you think about the patient's feelings. We don't have to attach our emotions. We don't need to be emotional, but you need to understand what your patient is going through. That's called as empathy, not sympathy. Never show sympathy. Sorry, wow, avoid it. Few empathy statements I've just put it. It's a short lesson. This will help you. Empathy statements, you can write it down and you can use it as the situation permits. First one, it sounds like this has been a stressful time for you. Patient says that I'm worried, I'm troubled, I'm going through this, that, this. Say, it sounds like this has been a stressful time for you. Let me help you with this. It seems to me that this has been a big worry for you. I can see that you appear to be very upset by this. Would you like to talk more about that? It is understandable to feel worried, upset, frustrated in this situation. I can understand your concern. I understand what you are going through. These are the statements which you can use. These are the empathy statements. You can use 2 to 3. No need to use 7. Learn 7 statements. Keep it ready with you. And practice. Only by hearting the statement will not help you. Next time when you do speaking, try to use 1 or 2, then 3, then 4. Then once you're used to it, you don't have to worry. You will have these statements when you require it. But practice. Because practice will make you perfect in these statements, how to use it. And just be natural. If you are able to be natural and use the statements, 400 and above, 450, 460, not a problem at all. Just use these statements. That's very important. Now, certain things to avoid when you do your speaking, making shock statements like, wow, I'm sorry. Don't do that. Shock statements, no, you don't have to be shocked. You're a professional. Never tell a patient that you should do. Don't give them directives. You can advise them, but don't give them directives. You must do this. You must stop smoking. No, 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 no. You're not their parent. Never do that. In India, you may be doing it, but when you think an international perspective, you cannot tell a patient what they must do. You cannot tell a patient they are wrong. As I told you, never say no. Insisting they should agree with you. You force someone to agree with you. Not at all allowed. That comes under patient safety. You cannot influence someone to do something what you feel. Instead, you can advise them. I would strongly advise that. You're providing an advice. It is understandable to think that way. Let me give you an explanation to that. I can see this is a big decision. Why don't I give you a leaflet and you can discuss it with your family and come back to me? So, whenever you want to give a pamphlet or a brochure, whenever you want to give a brochure, you can inform the patient. I know it may be a big decision for you, but I'll ensure that I'll give you a leaflet so that you can go discuss with your family and come back. So, you're not insisting them to agree with you. You're saying that I'll give you more information, I'll give you time. You go discuss with your family and come back. And the last point, whenever you're doing your OET speaking, be natural. Avoid long pauses. Don't maintain that dead space because understand the examiner who's sitting in front of you cannot give you any marks. But later, the same recording has been heard by the examiner at the CLBA, that's at OET, and they are giving you marks. So they cannot see your expression, they cannot see how your expressions are. What do you feel? Are you nervous? No, they just listen to your conversation. So that's an additional point. That's a plus point, I would say, because they're just listening to you. They cannot see your facial expressions. So ensure do not maintain any dead space. And these connectors and these statements can help you to maintain that status and to ensure to avoid any dead spaces. So ensure you practice on this. If you have any questions on OET speaking, you can definitely put it in the comment box as well. Now, the last slide, some pro tips I'll give you if you want to really score high. Whenever you want to put an empathy, ensure with an empathy you add a reassurance as well. Like example, you say, I understand your concern, but you put a reassurance word as well in that. But there is no need to worry. I can see why you're worried, but this is treatable. You are trying to put your patient at ease. So always ensure if you're using an empathy statement, combine reassure statement with that. That must be stressful, but we will manage it together. I know this sounds scary, but you are in safe hands. So combine empathy plus reassurance together. And a pro tip is combine empathy plus reassurance plus a plan. If there is something that you're going to describe a plan, that's a bonus point for you. Like you see that explain the advices that you need to give to the patient. So there are series of advices. So ensure you add a plan as well. Example, I understand this is worrying, but this condition is treatable and we will manage it step by step. Or I'll provide you advice step by step. So empathy plus reassurance plus plan. So whenever you have a task which is beginning with the word explain, you can use empathy plus reassurance plus plan. If you do this, I can ensure 450 and above, no problem at all. I believe this was useful for you. We'll ensure that we come up with these kind of lessons again and again so that you are benefited for your examination. So if you really like this video or this kind of learning, please comment in the comment box. I will be happy to read those comments and that motivates me to come up with new lessons. Perfect then guys, that's all for today. Thank you so much for joining in everyone. Any questions, you can put it in the chat box. I will be there to answer all your questions.